Hello, happy new year. A little bit late, but better late than never. So I just thought I might come on and talk a little bit about the different types of injectables that we have on the market in Australia, just to give people a little bit of a brief overview of the reasons that we would choose one versus another. So particularly for a new patient, it would be very overwhelming not understanding what all these things can do. So first of all, we have botulinum toxin or anti-wrinkle treatments, and these are used to stop muscle movement. So they can strategically be used, and the most common location would be the upper part of the face, but you can use them in other parts depending on what the issue might be. But we'll stick to the upper part just for, explanation purposes. So when you make an angry face, or when you're raising eyebrows up or doing a big cheesy grin, you see muscle movement which causes, the crinkling or the wrinkles in those areas. So we can use anti-wrinkle treatment to stop or dampen down the muscle movement so that the wrinkles in those areas are not as prominent. Now, anti-wrinkle treatment is not treating the skin, it's treating the muscles underneath. So, if you've got really thin skin or aged skin or very sun-damaged skin, it's not going to help with the skin quality. And this is why we often find that, we're limited as people get older with anti-wrinkle treatment, because there's only so much you can do in terms of stopping a muscle movement without affecting function to help with the wrinkles when the quality of the skin is lacking. So then we might look at other things that are actually helping with skin quality. And for today's video, I'm just not going to mention all of the devices, although they have a really huge role to play with skin. So after anti-wrinkle treatment, we then have dermal fillers. So that's probably another one that people would know about. Now, dermal fillers fill. That's what they do. They fill space. There's different types. You can use some to help with filling little fine lines, and you can use others to fill volume, depletion. So one of the common things that happens as the face ages is that we start to see gravitational pull and everything starts to sink down and sag, and you notice volume loss, particularly across the cheeks or under the eyes, in the temple area. So these are places that you can use fillers to fill. You can also use fillers in that perioral space or around the jawline to help with structuring or to help with fine lines and wrinkles or lip volume depletion. But my approach in that area is that we have to be very careful with overfilling, because we don't want to overproject this space so that it starts to look unnatural. So it has its place and it definitely can help, but it's just a fine line or a fine balance. Fillers don't lift, in my experience. They're not going to give you a facelift effect. So if you're really noticing heaviness and jowling, and this is what your main concern is, or nasolabial folds, yes, we can use filler to an extent, but if that's your main concern, that's not the only thing that I would suggest. There are other things that can help with that as well. So then we move on to the realms of biostimulators, and there's a fair few on the market. Example would be product S or product R, and these products are utilized to help with increasing collagen. So again, they're going to help with very naturally increasing volume in the sort of external part of the face, and that can sometimes very subtly give a little bit of improvement in the skin quality. So it's not a facelift, not going to be lifting centimeters of tissue, but it's certainly, if we're using it in this sort of external part of the face or lateral part of the face, it can just very subtly help with nasolabial folds and marionette formation, and it helps with skin quality. So the crepiness or the lots of wrinkling that people get, they'll start to notice that improves as well. Then we have the bioremodelling product, which I'll call product P, and that is a hybrid. So it's a hybrid between it's a hyaluronic acid, so it does help with fine lines and wrinkles. It's not giving volume, but the other thing that it does is it stimulates collagen production. So over time, with crepiness or the fine lines and wrinkles, it can actually improve that quality of the skin. Again, it's not a facelift, it's not going to be lifting tissue. So there, I guess I get a broad overview of the different types of fillers without being too specific on products and whatnot, and the things that they can do. There are limitations with all of them. As I mentioned, they're not surgery, so they're not going to be giving you the dramatic results that a facelift is going to give you or a neck lift is going to give you, but they can be helpful to improve volume replacement and to help with fine lines and wrinkles and skin quality. So that's a brief overview, and by no means is it individual advice. For that, you need to go have a talk to your aesthetic practitioner to figure out what product might benefit your issue or your face.